I got a client recently came in. He was like really in shape. Um, Maybe he's 60. I think it was 60-year-old man um, with shoulder impingement, so he couldn't lift his arm, past what is that, 75 degrees maybe. But what was interesting, the reason I bring him up is that's not atypical, and he went to a surgeon just to get checked out, and the surgeon basically said, I can't really help you. I mean, I could operate and probably work, but that's crazy. And he went to a PT and did some shoulder strengthening kind of maneuvers that helped a little bit, but not a lot. But then when I started to work with him, I put him on the ground, and I started to show him some stretches that I thought would be useful to him, just like after I did like normal warm-ups, range of motion, some strengthening stuff, but he had already done that. So that's why it was kind of interesting to me. And then I put him on the ground, and he told me that, and when I did the normal intake, like I didn't really catch this, but he told me that like for his entire life, basically that he can remember, like he couldn't, I don't know if you could see for those of you on the video, but anyway, he couldn't open his arm out to the side like that. And he had like really, 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 really tight pecs and super tight on one side. I mean, like ridiculously tight. And he didn't really do anything. He was in good shape, but he didn't like over exercise or anything. So anyway, I worked with him on that. And once he opened his pecs up, he could then raise his arm again. And so what I gathered from that was that it wasn't actually, the diagnosis was impingement because he was presenting with all the signs of impingement, which is basically not being able to lift your arm up. But actually, I think it was referral pain from his pecs, like a trigger point. And so I thought that was interesting because I see why the PT didn't catch it, because the PT was given a diagnosis. And I think what the PT did was probably sees shoulder impingement like 5 times a day, because it's really common. And the PT didn't assess him. And then when I looked at him, I actually assessed him and started sort of messing around with his body, trying to figure out what it didn't do. And so we came upon this thing, and actually, I think we like stretched out his trigger point. So I only share that because it would be easy to miss that. And I was really surprised. I've done a lot of shoulder impingements, similar most of the time, but it reminded me of how important it is to assess people for range of motion and how to sort of, in your mind, kind of go through all the possibilities. And it also reminded me of how, as a yoga therapist, I had an hour with him. So, I didn't get to that till probably 45 minutes in. And I think that's probably 15 minutes more than your typical PT appointment here. So I don't know. I thought that was really interesting. And anyway, I've worked with him. He's been doing his stuff really religiously, and he's like almost 100% better. So he kind of went from being at the surgeon and sort of trying to figure out this impingement thing to being completely better. And the problem, I guess the other interesting thing is the problem had been developing over a few years. So he's basically had 3 years of reduced range of motion and a shoulder and pain, and he's gotten himself out of it. I mean, I'm trying to remember when he came in, but maybe 8 weeks tops, 6 or 8 weeks.